In this program, we will explore the impact of suboptimal peak inspiratory flow, or PIF, on the treatment of patients with COPD. Please use the link above to access the full prescribing information for Stiolto Respimat, patient information, and instructions for use. Today, we will be joining Dr. Vagoda, a pulmonologist, as she visits with her patient, Nick. Nick is a 50-year-old male who was diagnosed with COPD 3 years ago and who has a 30-pack year history of smoking. Nick has noticed a recent increase in his COPD symptoms and in his reliance on his albuterol inhaler. He is visiting Dr. Vagoda today in order to discuss whether a change in his current treatment course might be warranted.
Physically, everything looks fine, no sign of infection. But you've been using your rescue inhaler much more than usual.
Yeah, that's right.
Why don't you tell me about that?
I'm always out of breath and I wheeze a lot too. It hits me when I'm doing little things like walking to the mailbox.
So we're not talking about strenuous activity.
No, it happens then too. Horsing around with the kids, yard work, but this is different. This is all the time.
I don't like the sound of that. I think we might want to add a maintenance treatment on top of your rescue inhaler, something that will help reduce those symptoms on a daily basis.
Would I take it like the rescue inhaler when the symptoms hit me?
In order for this medication to work properly, you'll need to use it every day. Just 2 puffs, 1 time each day, at the same time of the day.
I think I can handle that.
There are lots of effective treatment options to choose from, but the medication I want to put you on is called Stiolto Respimat, tiotropium bromide and olodaterol inhalation spray. I'm worried that your symptoms might affect your ability to inhale sharply enough to allow some of those other inhalers to optimally activate.
Indication for Stiolto Respimat. Stiolto Respimat, tiotropium bromide and olodaterol inhalation spray, is a combination of tiotropium, an anticholinergic, and olodaterol, a long-acting beta-2 adrenergic agonist, LABA, indicated for the long-term, once-daily maintenance treatment of patients with chronic obstructive pulmonary disease, COPD, including chronic bronchitis and/or emphysema. Important limitations of use. Stiolto is not indicated to treat acute deterioration of COPD and is not indicated to treat asthma.
Even patients like Nick, who have never been on a maintenance treatment, can suffer from what is called suboptimal peak inspiratory flow, or PIF. PIF is the maximal airflow generated during the peak inspiratory cycle. Many DPIs require an optimal PIF, or a flow greater than or equal to 60 liters per minute, in order to optimally activate. With these DPIs, a forceful inhalation is required to optimally separate the medicine from the carrier particles. For patients like Nick, whose PIF may be suboptimal, below 60 liters per minute, generating such a forceful inhalation can pose a challenge. For such patients, I'm going to prescribe a treatment in a slow mist inhaler, such as the Respimat inhaler, which delivers active medication independent of inspiratory effort. As with all inhaled drugs, the actual amount of drug delivered to the lung may depend on patient factors, such as the coordination between the actuation of the inhaler and inspiration through the delivery system. The duration of inspiration should be at least as long as the spray duration, 1.5 seconds. A correlation between deposition data and clinical efficacy has not been demonstrated in large clinical trials. The GOLD guidelines specify that follow-up treatment decisions like this one should be based on exacerbations and on symptoms such as dyspnea rather than on GOLD group status. Even patients with mild COPD can have suboptimal PIF, and in Nick's case, suboptimal PIF may very well have played a role in the increased symptoms he's been experiencing of late. So, this is what I'd like you to try. It's what we call a LAMA-LABA, which means that it contains 2 different medications that work together.
So it's a puffer like my albuterol.
This inhaler releases a slow-moving mist. And of course, you'll use it daily, as I said before, and not just when the symptoms come on. I will write a note to assemble and prime so the pharmacist will prep it for you the first time. When you pick up the prescription, be sure to remind the pharmacist. In the meantime, let me show you how to use it once your Respimat inhaler is ready to go.
Sure, that sounds good.
There are 3 steps for daily use that you can remember with the acronym TOP, or TOP. T stands for turn the clear base. With the cap closed, turn the clear base in the direction of the arrows on the label until it clicks. It will be half a turn. O stands for open the cap. Open the hinged cap by pushing up on the small circular tab until the cap snaps fully open. Finally, P stands for press the dose release button. First, breathe out slowly and fully. Then close your lips around the mouthpiece without covering the air vents. Now, point the inhaler toward the back of your throat. While taking a slow, deep breath through your mouth, press the dose release button and continue to breathe in. Hold your breath for 10 seconds or for as long as comfortable. You should refer to the patient instructions for more detailed information. Does that all make sense?
Sure, no problem. TOP. Got it.
Great.
Important safety information for Stiolto Respimat. Contraindication. Use of a LABA, including Stiolto Respimat, without an inhaled corticosteroid, ICS, is contraindicated in patients with asthma. Stiolto is contraindicated in patients with hypersensitivity to tiotropium, ipratropium, atropine derivatives, olodaterol, or any component of this product. In clinical trials and post-marketing experience with tiotropium, immediate hypersensitivity reactions, including angioedema, including swelling of the lips, tongue, or throat, itching or rash have been reported. Hypersensitivity reactions were also reported in clinical trials with Stiolto.
Inhalability is what Stiolto Respimat provides, namely the ease with which actual patients can inhale their medicine. The active delivery of the Stiolto Respimat inhaler means there's no need for patients to sharply inhale in order to release the medicine. Independent of inspiratory effort, Respimat delivers nebulized medicine for inspiratory ease and deposits small particle-sized droplets deep into the patient's peripheral airways. As with all inhaled drugs, the actual amount of drug delivered to the lung may depend on patient factors, such as the coordination between the actuation of the inhaler and inspiration through the delivery system. The duration of inspiration should be at least as long as the spray duration, 1.5 seconds. A correlation between deposition data and clinical efficacy has not been demonstrated in large clinical trials. For patients like Nick, who suffer from suboptimal PIF, Stiolto Respimat may help control his symptoms in as little as 5 minutes and for up to 24 hours. Stiolto Respimat can address such symptoms as chest tightness, cough, wheezing, and dyspnea. Stiolto is not a rescue medication and does not replace fast-acting inhalers to treat acute symptoms.
Important safety information for Stiolto Respimat. Continued. Warnings and precautions. LABA as monotherapy without an ICS for asthma increases the risk of asthma-related death, and in pediatric and adolescent patients increases the risk of asthma-related hospitalizations. Do not initiate Stiolto in patients with acutely deteriorating COPD, which may be a life-threatening condition, or used as rescue therapy for acute symptoms. Acute symptoms should be treated with an inhaled short-acting beta-2 agonist. Stiolto should not be used more often or at higher doses than recommended, or with other LABAs as an overdose may result.
Stiolto also reduces exacerbations and exacerbation-related hospitalizations independent of ICS use. In a 1-year randomized double-blind parallel group study, tiotropium, an active ingredient of Stiolto, reduced the risk of exacerbations by 31% compared with placebo and reduced the risk of exacerbation-related hospitalizations by 27% compared with placebo. Additionally, when compared with Spiriva Respimat, tiotropium bromide inhalation spray, Stiolto Respimat showed a 7% reduction in the rate of exacerbations. The p-value of 0.049 in this particular study did not meet the pre-specified significance of 0.01. Let's return now to my visit with Nick. So, do you have any questions?
No, I think I'm okay, and I take it every day, right?
2 puffs, 1 time a day at the same time every day, as we discussed. It may take a couple of weeks for you to notice the full effects. I'd like to see you again in a month to see how you're doing. In the meantime, keep your rescue inhaler with you at all times and call us immediately should you have a flare-up.
I will for sure. Thank you, doctor.
You're very welcome.
Important safety information for Stiolto Respimat continued. Warnings and precautions continued. If immediate hypersensitivity reactions occur, such as urticaria, angioedema, rash, bronchospasm, anaphylaxis, or itching, discontinue Stiolto at once and consider alternative treatment. Patients with a history of hypersensitivity reactions to atropine or its derivatives should be closely monitored for similar hypersensitivity reactions to Stiolto. If paradoxical bronchospasm occurs, discontinue Stiolto immediately and institute alternative therapy. Stiolto can produce a clinically significant cardiovascular effect in some patients, as measured by increases in pulse rate, systolic or diastolic blood pressure, and/or symptoms. If such effects occur, Stiolto may need to be discontinued. Use caution in patients with convulsive disorders, thyrotoxicosis, diabetes mellitus, ketoacidosis, in patients with known or suspected prolongation of the QT interval, and in patients who are unusually responsive to sympathomimetic amines. Use with caution in patients with narrow-angle glaucoma. Instruct patients to contact a physician immediately if signs or symptoms of acute narrow-angle glaucoma develop. Use with caution in patients with urinary retention, especially in patients with prostatic hyperplasia or bladder neck obstruction. Instruct patients to consult a physician immediately should any of these signs or symptoms develop. Patients with moderate to severe renal impairment, creatinine clearance of less than 60 milliliters per minute, should be monitored closely for anticholinergic side effects. Be alert to hypokalemia and hyperglycemia. Adverse reactions. The most common adverse reactions with Stiolto, greater than 3% incidence and higher than an active control, were nasopharyngitis, 12.4%, 11.7%, 12.6%, cough, 3.9%, 4.4%, 3.0%, and back pain, 3.6%, 1.8%, 3.4%. Drug interactions. Use caution if administering adrenergic drugs because sympathetic effects of olidaterol may be potentiated. Concomitant treatment with xanthine derivatives, steroids, or diuretics may potentiate any hypokalemic effect of olidaterol. Use with caution in patients taking non-potassium-sparing diuretics, as the ECG changes and/or hypokalemia may worsen with concomitant beta agonists. The action of adrenergic agents on the cardiovascular system may be potentiated by monoamine oxidase inhibitors or tricyclic antidepressants or other drugs known to prolong the QTc interval. Therefore, Stiolto should be used with extreme caution in patients being treated with these drugs. Use beta blockers with caution as they not only block the therapeutic effects of beta agonists, but may produce severe bronchospasm in patients with COPD. Avoid co-administration of Stiolto with other anticholinergic containing drugs, as this may lead to an increase in anticholinergic adverse effects. Stiolto is for oral inhalation only. The Stiolto cartridge is only intended for use with the Stiolto Respimat inhaler. Inform patients not to spray Stiolto into the eyes, as this may cause blurring of vision and pupil dilation. CL STO 100021 65/2019. Please see accompanying full prescribing information, patient information, and instructions for use for Stiolto Respimat. Thank you for participating in this program.